Hi, I'm Dr. Pierre, here to talk about the laser procedure called YAG vitralysis, used to treat floaters. Seeing floaters is a fairly common symptom. You may notice little black dots or cloudy blobs that seem to shift and sway around your visual field. These usually result from imperfections in the jelly substance or vitreous that fills the eye. Such imperfections catch the light and scatter it, or cast a noticeable shadow, which may or may not be bothersome. Not all floaters are created equal. Some are safe to treat and some are not. Some people respond well to the minimally invasive laser, while others require surgery to remove them. During your eye exam, what I see will let me know what to recommend for you. YAG vitralysis works by using a laser, which is a cutting tool, to reduce the floater's large mass with its large shadow into tiny pieces which cast tiny, less intrusive shadows. It can also encourage the floater to disintegrate and move central floaters off to the side into a less bothersome location. The most common type of floater is called a Weiss ring. These usually develop sometime between the ages of 50 and 70, when the vitreous jelly naturally separates from the retina. The floater you notice is the old connector piece that now casts a shadow on the retina, producing a bothersome effect, usually described as a black spot. When the vitreous separation process occurs, it usually causes you to see some flashes of light. The strands of jelly pull on the nerves in the retina and cause them to misfire. Once the flashes have been gone for a few months, floaters of this type usually respond well to the YAG vitralysis. If the Weiss ring's location is far enough away from the retina, I expect YAG vitralysis to be very safe. However, if it is too close to the retina, the cutting laser risks damaging the retina. This would trade a merely annoying problem for a blinding problem, so if the floater's location is not optimal, I will recommend waiting until it is. Also, patients can develop a different kind of floater, in which cloudy protein deposits in the vitreous toward the front of the eye. This type of floater causes a blurry blob or fog that moves around in the visual field. These cloudy strand-type floaters tend not to respond as well to the laser, and I will likely refer you to a trusted retina specialist for surgical removal of the floater if it is bothersome enough. What is the procedure like? To maximize safety, only one eye is treated at a time. At the surgery center, a dilating drop and a numbing drop are placed in the eye. You simply sit at the microscope as you would during a regular eye exam and look straight ahead. There is no need for anesthesia. I will place a contact lens on the surface of the eye to get the best and safest possible view, so you don't have to worry about blinking. You will see a bright light and hear a series of clicks for a few minutes while I identify the floater and treat it with the laser, but you will feel no pain. Immediately after the procedure, it is normal for the vision to be blurry and dim because of the eye drops and the bright light. Clarity should return after a few hours, if not sooner. Some patients feel comfortable driving themselves home. There are usually no drops or activity restrictions afterward. You may go about your life as normal. After 1 week, your eye will be checked to ensure proper healing. Regarding your symptoms, you will probably note an improvement in the first week, but the real benefit comes in a few months, after your brain has gotten used to the newly modified floater. If your floater is significantly impacting your daily life, YAG vitralysis is often covered by your insurance. However, some insurance plans will not cover the procedure. Our staff will check your benefits beforehand. When a floater first develops, the simplest alternative to having the YAG vitralysis is to leave it alone, but it is not expected to go away by itself. Most people's brains are able to automatically ignore the floater after a few months. That is why I recommend 3 or 4 months of waiting before we address it. Some patients are not able to ignore them, and some floaters are too big to be ignored. The other alternative is a surgery called pars plana vitrectomy. This procedure completely clears the vitreous jelly from the inside of the eye along with any floaters. A clear saline fluid fills the eye from then on. The surgery requires a trip to the operating room under mild sedation and takes 20 to 30 minutes, but is low risk with a generally easy recovery period involving a few activity restrictions along with eye drops. This procedure has become less invasive and even safer over the past few years. For many people, and for certain floaters, the surgery is the best option. I will let you know if you fit in this category. The intended benefit of YAG vitralysis is to decrease your symptoms from the floater using a minimally invasive method without actually removing it surgically from the eye. The risks of YAG vitralysis are rare. Major risks include damage to the delicate structures inside the eye that surround the floater, especially the retina, the optic nerve, or the lens. I have had good, safe results because I am very selective about which floaters are safe enough to treat and which are not. The most common minor risk of YAG vitralysis is that sometimes, despite our best efforts, the symptoms do not seem to be less bothersome. It would be very rare for the symptoms to be worse. If floaters are still bothersome 3 or 4 months after YAG vitralysis, we may consider further treatment with the laser. Sometimes a patient's brain demonstrates that it is unable to ignore the floater even after it has been reduced by the laser. In such cases, I may recommend the surgery with the retina specialist is the next step, but at least we will have tried the less invasive, simpler method first. YAG vitralysis is a straightforward, effective, and safe procedure for the right candidate. If you have any questions, please feel free to ask beforehand. For more information on YAG vitralysis for floaters, please review my educational leaflet and consent form.